Hi friends, can you believe that we are wrapping up our final lecture for this class this semester? Pretty crazy. So today we are talking about chronic diseases. We are doing a major pivot from where we have been related to this pandemic, where we've been applying everything in this class essentially to an infectious disease or a communicable disease. And that is something that used to play much more heavily into public health 100 years ago and beyond, because that is how most people died, was from infectious or communicable diseases. In the last 100 years, that has completely shifted so that now most of our deaths are occurring from chronic diseases that have a lot more prevention associated with them and things that we can do to prevent them from causing death. And so that's what we're wrapping up with today. We are not talking about COVID-19. We are kind of going back to what the public health community mostly focuses on and kind of where we're moving forward, which is chronic diseases. So let me share my screen with you and we'll get going. First thing I wanted to share with you is just this infographic here, which kind of sums it all up perfectly. This is from the County of San Diego, but this is a slogan that's used all over the country. It's basically called 3-4-50. And it says that more than 50% of our deaths are resulting from 4 main diseases, and those diseases are connected to only three health behaviors. Pretty phenomenal when you think about it, that we've been able to narrow down the majority of our deaths to 4 diseases and 3 behaviors. Now, usually when we're in class and we go over this, I don't give you this infographic ahead of time, and we kind of brainstorm about what those 4 diseases might be, and we vote, and then we vote on the top 3 behaviors that we think it might be. It's really fun. Not sure how I could have recreated that here. So I'm just giving this to you, and then we're going to have a discussion about it as a class. So part of your reading is going through a document from the county that explains 3-4-50 in a little more detail. That's your reading for this week. Pretty simple. And then what I'm sharing with you here is actually a PowerPoint that's not mine, but it's from a presentation that I went to in December. And I think I've mentioned this before in class, but essentially every 3 years, every group of hospitals or healthcare organizations is required, is mandated because of the Affordable Care Act, to conduct an extensive community health needs assessment, where they basically work together, they go out in the community and they find out what the main community health needs are, so that hospitals are not just doing tertiary care, which is what they're known for, but that they are also looking at secondary and primary levels of prevention as well, so that they can actually help reduce the tertiary care that is happening and help with these preventable deaths. So I'm not going to go through this whole PowerPoint. This is here for you. Some of this stuff isn't going to make much sense if you weren't at the presentation. So I'm just going to kind of click through and tell you what's really important. So this just talks about the history of the Affordable Care Act and how it mandates this. And basically this group is called the Hospital Association of San Diego and Imperial Counties. HASDIC is the other name for it. And they're basically the group. They have representatives from every major hospital system in San Diego and Imperial County that gets together and works on this for years. It's a pretty incredible thing that they do. These are what's called the CHNA requirements, so Community Health Needs Assessment requirements. They need to define their community, so that would be our 2 counties, assess the health needs, look at all of the different interests, create a written report that is then adopted by hospitals and make it available to the public. Myself and Dr. King went to the unveiling of the report for public health providers in San Diego in December. These are all the different hospital partners, and obviously you know them. You've done clinicals there, or you're employed with some of these places. So purpose of this process, they're trying to analyze and identify what the problems are, narrow them down, prioritize them, and then come up with plans for what we can do and report out. So they started in 2016, which was when the last report came out. They looked at the findings. They tried to see, when they started to assess the community again, are those findings still consistent with what the needs that we're seeing now, kind of moving forward. That's too small, so we won't go there. This map is really hard to read, so I'm not going to go over this. This is really important for you to see just how many people they talked to and what they did. So they had 12 in-depth interviews. They had 214 people participate in 18 different focus groups. So people are meeting together and being interviewed as a group. Then they sent out surveys to 353 people. So overall, 579 people were a part of these results. I'm going to say that's still a bit small considering we have over 3 million people just in San Diego County. However, that's a good start. It's a good start on getting an idea of what our health needs are in the community. And this is also really important because this is helping you see how broad the scope was. So it has on the left the types of organizations that were a part of this surveying and interview process. So you've got housing providers, obviously not just healthcare people. You've got government, schools, FQHCs are federally qualified health centers. So those are for Medi-Cal, Medicare, and uninsured people. It talks about all the different populations served or represented. So that's what's really important, is that we're making sure that vulnerable populations are represented here, such as the LGBTQ population, Native Americans, refugees, immigrants, etc. So they definitely hit a lot of important vulnerable populations. And then it talks about all the different roles of participants. So again, some are healthcare providers, some are law enforcement persons, all kinds of different people, educators, etc., that are involved in the process. And then the most important piece is looking at their findings. So it's interesting to see how far they've come. Back in 2013, they just named the top 4 health conditions. So remember 3, 4, 50, naming top 4 health conditions. In 2016, they did that again, but then they added 10 top social determinants of health. So that's good. We're moving in the right direction. And finally, in 2019, they combined health conditions and social determinants of health, because we are finally recognizing those things go hand in hand, and we can't just have health conditions without also talking about the social determinants of health that play into them. So now all of those are grouped into a top 10, which I'll show you. So this is from 2016, and it shows that our top health need from 2016 was behavioral health, not too surprising, and then cardiovascular disease, type 2 diabetes, and obesity. And then it has the social determinants of health on the right. Those things have really not changed, but now we're looking at it more holistically. So this is current findings from 2019, and basically it has the top 4 health concerns on the bottom. So again, remember, they're not necessarily medical diagnoses, but they're broad health conditions. And then the top is the 6 most prevalent social determinants of health. And I think what's really great is that they have accented on the sides of the circle stigma. And that stigma is something that weighs in heavily in all of these conditions and social determinants. And then if we continue to have stigma in our society about mental health conditions, about homelessness, etc., then people are not going to seek help. They're not going to be able to access help that would help them get out of these conditions. Now, I'm not going to read through all of this here. I want you to read through all of this. This is the stuff that's really the meat of their findings. They have taken, I believe, 5 of the top 10 findings and have showed you a little more detail what the stats are for our county. And then some quotes from some of their interviews, which is really, really interesting. For example, a college student on the bottom here, when speaking to access to healthcare, says, "I'm the only one in my family that can translate during appointments for my family. It's a lot of responsibility." So that is going to limit that family's access to healthcare. If they don't have translators in their language, they're not going to be able to understand the materials that they receive unless they bring their one college student family member with them, which really limits that access to healthcare. So it talks about, again, the national narrative of anti-immigration and how that affects people as well. That was something my honor students, when they did qualitative interviews last year with City Heights participants, that was definitely something that came up a lot, was the fears of seeking healthcare because of the anti-immigration sentiments in our country. Economic security is a huge one. It's pretty awful to me to see that 18% of children in San Diego live below federal poverty level, which is $25,000 a year for a family of 4. As you know, that's nothing. That's nothing. And 18% of our children live below that. 33% of our families, so a third of our families in San Diego, cannot cover their basic expenses. That is just a horrific statistic. Housing and homelessness, we've talked a lot about this in our class, so I won't read any more of this, but I want you to read this. This is really important information. And behavioral health is also a really interesting one. ED rates for anxiety in kids have especially increased. Um, and suicide rates have especially increased among people of Asian or Pacific Islander descent, Black individuals, and then people who identify their race and ethnicity as other. This quote's really important. This says that finding a therapist who has immediate availability is extremely challenging. And for people without insurance, it's impossible. This is so, so true. If you yourself have tried to find an affordable therapist that you can meet with quickly, or if you know someone who has, it is so incredibly challenging, even with insurance. And so you can imagine without insurance, it is near impossible. And then aging concerns, and it talks about death, leading causes of death for people who are 65 or older. Stress and depression also plays into that, as you can see in this quote below, where it says stress is affecting their overall physical health. Seniors are also more depressed, leading to a limited quality of life. These maps are kind of hard to read, so I'm not going to go into detail. What I want to also point out to you here, this will be part of your assignment for this week, is that they wanted to start a conversation with healthcare providers and public health about this on Twitter. And so what I want you to do is go to these hashtags on Twitter, or go to the handle on Twitter and find things that people have sent in about what they recommend doing to address these priority community health needs, because that's now where we're at, is how can we figure out specific ways to address these health needs now that we know what they are. So if you want to contribute your ideas, please feel free to do that, but I'd like for you at least to see what's out there, what people are saying. Overall, what the current recommendations are, they're not specific yet, they're very broad, but the recommendations have to do with overarching strategies. That's when we talk about health promotion strategies, how to expand or develop more resources to meet these needs, and then how can we actually change policies, so approach it from a more systematic standpoint. So that's the end of that presentation. And I hope that this is helpful for you moving forward from this class, that you see that chronic health needs are really where the majority of our health disease burden is falling, and that it can be really narrowed down to some specific things that we can begin to address here in San Diego County.